Now I'll quickly try to move to the next issue, which will be discussing its application in orthopedics. And this is what is known as what? Joint aspiration. So joint aspiration, I'm just trying to take up some contents from the joint, of course, so that I can send it to the lab and be able to do some 1 or 2 tests. So joint aspiration is also called what? Arthrocentesis. It's a medical procedure. This is where the doctor will use a sterile needle so that they can be able to remove fluid from a joint. This is a needle here, okay, through the joint space. So you use it in diagnosing a lot of things and also treatment. So you use it in diagnosing, all those infections of the joints, gout and pseudogout. That's when you're having crystal deposition in the joint fluid. You also check for all those autoimmune conditions that the body is actually attacking its own cells. You rule out bleeding disorders. So treatment, you can use it to actually remove some fluid so that you can reduce the pressure there, improve mobility in the swollen joints. Sometimes you combine it with injection of medication. As you are removing the fluid, you can also inject some 1 or 2 things to calm down the inflammation there. So common joints that these things can be done on include the knee, the shoulder, the elbow, the ankle, and the hip. So what happens to the fluid? You send it to the lab to check if there's microorganisms, to check if there's crystals, to check if white blood cell count there is actually increased, and also chemical analysis.